My name is Shannon Secrest. This is my son Logan. He's almost 14. This is my daughter Haley. She's almost 12, and we live in Lakewood. So my son is almost 14. He actually became eligible for Medicaid probably around 10 years ago. He actually originally qualified for Medicaid through SSI. And of course that's income based, so it was because we were low income that both of my kids qualified. And then just recently he now qualifies for Medicaid through one of the home and community based services waivers, which is the Children's Extensive Services waiver, and that's designed for kids who will need long-term care. Long-term supports and services. So my son actually has 8 different diagnoses. Some of them include he's deaf, he has autism, he has a mental health diagnosis, he has things like pica, which is eating non-food items. He's incontinent, just kind of this laundry list of complicated medical issues. And so for him, it's meant different treatments, different therapies. He's had some other ancillary surgeries, like for his eye, he had to have eye surgery, things like that. That over the last 10 years, there's no way I could have paid for that. You would be talking about thousands upon thousands of dollars that would have accumulated that I otherwise would never have been able to pay for. And again, this is not something where for some people who have kind of an acute, like their gallbladder or something where it's kind of a one-time thing. My son will literally need a lifetime of supports. So from the now until the day he's gone, he will need those supports. And so, again, it's not just about understanding that Medicaid is important today. It's that those same services, or better, we hope, are available to him and to us throughout his lifetime. I'm probably part of that working poor-ish, trying to live hand to mouth, making sure that my bills are paid, but still having kids that qualify for Medicaid. There are so many of our friends and family, loved ones, co-workers, that any Medicaid cuts would literally mean dying. It would literally mean dying. But for me, I guess it's the idea that I already live hand to mouth. And so any kind of cuts to his programs or services or Medicaid funding would mean that either he's not going to get those services, they're going to be not great services, or again, that I would be expected to pay for them. And that's something that at this point, being a single mom, being a single parent, I also have a daughter, it's just because of the medical necessity surrounding those 8 diagnoses, I don't have the option to just go out and find the job that I want, do what I want.